2.
Hi. So today on our channel, what we're studying is this incredible research article that I just came across that was just published in February of this year by Cambridge University on developmental brains and kids with learning and imbalances. About 14 to 30% of the youth and adolescents have some type of cognitive behavioral imbalance, learning disabilities, other things. And for so long, the research has shown that dyslexia is a specific area of the brain, ADD is a specific area of the brain, ADHD is a specific area of the brain. And what I've seen in clinic for the last 8 years, I've never seen it that specific. This area is this part. This area is this part when it comes to learning and how the brain adapts. And I've always struggled with that because I was taught it's this area, but when we apply brain exercises to that area, it didn't always make a difference. And then through our diagnostics, we find a certain area that's unrelated to that, change that area, and it makes all the difference in that kid's responsiveness to dyscalculia or dyslexia or ADD, ADHD. So I came across this paper, again, that was just published. We have the link below. You can research it, read all the details. But they talked about how that their theory of a specific area of the brain isn't as exact as a hub-based connection. Now you might ask, what's a hub-based connection? Meaning, as the circuits are connecting through different loops and different connections and different neuronal pools, they're having a greater change. The better the connection is in these hubs, the better outcome and the more specific a brain can be, versus those that have poorly connected brains, their behavioral and their learning disabilities are all over the charts. So what they're showing is that you need less of a differential diagnosis of a child and more so what part of the brain isn't working. I want to show you this because this is what I've seen in my practice over the last 8 years. I just thought I was a theorist all by myself, seeing things, but didn't have the validation neuroscientifically. And now with this research, it's the beginning start of understanding why I treat a dyslexia different on 20 different patients, or someone with ADD, it works differently in all of their brains. So let me show you. Again, this is based on this link below that you can see the article and read it for yourself. But as I told you, I'm taking this research, I'm applying it the way I see it in clinical practice and explaining it to you guys how it affects or how it can adapt to what you're dealing with. So a lot of times people have the diagnosis of ADHD, and this has become kind of the norm now, and there's so many substrates of it, and I want to tell you what the research showed and what they discovered. There are multiple areas of the brain involved in this, and when you look at the brain, you're trying to figure out which part of the brain is most involved when it comes to this ADHD. And you have your thalamus here. Okay, so I'm just brainstem, cerebellum, cortex, thalamus. Now, with ADHD, there are multiple areas, so I'm going to draw these out as I label them, and I'm going to get the list directly from them. So they talked about the anterior cingulate gyrus, so your anterior cingulate cortex. So the anterior cingulate cortex sits like this, okay? Anterior cingulate cortex. This is one area of the brain that's found with ADHD. Then you have your caudate nucleus, and then you have, again, the caudate nucleus. And the caudate nucleus goes around this hippocampus, and then you also have your amygdala, which is another section, which is towards that end, as they showed that the amygdala can be involved, the pallidum, the striatum, so there are more substrates in here that are also involved, okay? And then you also have the cerebellum, which is this whole section. And then you have your premotor cortex, so your motor strips here, your primary motor cortex, and then your premotor cortex is right here, okay, the prefrontal cortex. You also have the prefrontal cortex, which is this area, and then most of the parietal lobe. most of the parietal lobe. So as you can see, the real question is, what's not involved in ADHD? And I wanted to just explain this to you. When you're dealing with ADHD, or other differential diagnosis, there's more to the brain than just a specific area. You can't just go to this or that. And there's been so much research now that's validating this study and showing that you need to understand every aspect of the brain in order to change these learned behaviors or these other systems. And what has been amazing is in the article, it talks about the medication used for specific children with disabilities. And unless the neural hubs are all working and it's a specific area, drugs can go really quickly to specific nerves, but it doesn't do well in a hub-like environment. So if you have used medication and it's not making the difference in your child that has a learning disability, you gotta start thinking of which pathways aren't working and which hubs aren't connected, and that's what we do here at Brain Rehab. The key is, what are you doing to strengthen the overall wellness of your brain and finding the areas that don't work in your child or yourself versus just putting through a systematic approach. Hope you enjoy it. Read the article and comment below if you have any questions that you'd like me to expand upon. Thank you.